Hi, in this video we shall be looking at the physiology of the bone as well as a few diseases related to the bones. So upon exposure to ultraviolet light or UV light, 7-dehydrocholesterol is converted to vitamin D3 in the skin. We also get vitamin D from the foods that we eat. Now vitamin D is converted to calcitriol in the liver under the influence of estrogen. And for that matter, in estrogen deficiency, for example, in postmenopausal women, then this can lead to osteoporosis. Now, calcitriol is then converted to calcitriol in the kidney, and that is under the influence of parathyroid hormone. And for that matter, in a case of, say, renal failure, then there will not be the formation of calcitriol, or the formation of calcitriol will be inhibited. Now, calcitriol is very essential in bone formation and bone mineralization because it increases the plasma concentration of calcium and phosphate. And then calcium and phosphate induces or promotes mineralization of the bone. And on the other hand, alkaline phosphate inhibits mineralization of the bones. Now, glucocorticoid also inhibits mineralization and proper development of the bones. And on the other hand, insulin promotes proper development of the bones as well as mineralization. And therefore, in a case of insulin deficiency, the proper development of the bones will be inhibited. Now, when the bone is demineralized, or when there is demineralization of the bone or breakdown of the bones, calcium and phosphate is released into the system. Now, increased calcium and phosphate in the system is going to lead to formation of stones in the kidney. And this is going to lead to the abnormality or the disease called urolithiasis. And this is popularly known as kidney stones or stones in the kidney. Now, mechanical use of the bones, or for example, in a patient or a person who is very active, that is going to lead to mineralization as well as bone buildup. And on the other hand, lack of mechanical stress or inactivity, for example, in bedridden patients or patients who have tetraplegia, that is paralysis of the four limbs, then it means that there is a high possibility of bone breakdown due to the lack of mechanical stress. And bone breakdown is going to increase the breakdown of osteoid in the bone. And basically, the osteoid is the matrix of the bone. So breakdown of osteoid is going to increase the urinary or renal excretion of hydroxyproline. Now, hydroxyproline is a major component of protein collagen. And for that matter, clinically, we can measure the urinary content or plasma content of hydroxyproline to aid in the diagnosis of osteoporosis. Now, osteopenia is regarded as a precursor to osteoporosis, but it doesn't mean that any patient who developed osteopenia would eventually have osteoporosis. Now let's look at a few side effects or effects related to osteoporosis or osteoid breakdown. First, we can have skeletal pain, vertebral prolapse, fracture of the ulnar, radius, or the neck of the femur. Now, in localized degradation or breakdown of the bones, we can have an increase in osteoclast activation factor, and that in the presence of a tumor is going to boost or increase demineralization of the bones. Now, demineralization of the bone leads to osteomalacia or osteomalacia. Now, osteomalacia in children is called rickets. All right. Now let's look at a few of the symptoms related to osteomalacia as a result of demineralization. Now, first of all, we can have bone pain, spine deformity, fractures, as well as muscle weakness due to the deficiency in calcium. Now let's look at construction and mineralization of the bones. So as we may know, the bone is made up of matrix, which is the connective tissue, as well as minerals. Now some of the contents of the matrix include sulfate-containing proteoglycans, glyco-proteins, as well as collagen fibers. And some of the minerals contained in the bones include alkaline salts of calcium, phosphates, sodium, carbonate, magnesium, and potassium, as well as fluoride ions. Now, as we saw in the previous slide, insulin stimulates the proper development as well as mineralization of the bones, whereas glucocorticoids inhibit mineralization of the bones. Now, mineralization of the bone is also stimulated by phosphate, increased plasma concentration of phosphate and calcium, like we saw earlier on. And this is due to the influence of calcitriol. Now, we said that calcitriol increases the plasma concentration of phosphate and calcium. And this phosphate and calcium goes on to stimulate mineralization of the bones. On the other hand, pyrophosphate inhibits mineralization of the bones. And this occurs because alkaline phosphatase. So over here should be alkaline phosphatase. So alkaline phosphatase splits pyrophosphates. And when alkaline phosphate splits pyrophosphates, and by the way, alkaline phosphatase is an enzyme that is produced by osteoblasts. And when pyrophosphate is split, then it's going to inhibit mineralization of the bones. So we can actually measure osteoblast activity by measuring the plasma concentration of alkaline phosphate or alkaline phosphatase. All right. Thanks for watching. See you in the next one.